There is a gap between accessibility and affordability of healthcare for different socioeconomic groups in Africa. Kenya is not an exception. Access Afya, a social enterprise founded by Melissa Menke in 2012, fills this gap through the creation of access to quality healthcare through sustainable care model. Access Afya ensures that patient-centered, outcomes-oriented, digitally driven primary healthcare is accessible to even the most underserved populations. Access Afya runs a chain of micro-clinics in informal settlements in Nairobi. The clinics provide consultations, lab tests, chronic condition management, immunizations, family planning, antenatal and postnatal care, and urgent care to the community.
Hi, my name is Dr. Daphne Kunjuri. I'm the Managing Director for Access Afya Health. Access Afya is a social business that designs sustainable healthcare models for the global mass market. We have 4 different arms within Access Afya. We have the Access Afya Data and Informatics arm. We have the Access Afya Health, which is our service delivery arm. We have Access Afya Labs, which is our innovation hub, and we have Access Afya Advisory Services. So I'm going to maybe spend a bit more time just talking more about Access Afya Health. Access Afya Health, like I said, is our service delivery model, and we essentially deliver primary care to people in the informal settlements within Nairobi. We do this through our clinic model and our field care model. And so through those access points, patients are able to access the scope of primary healthcare services from general outpatient visits to antenatal care, to immunizations, to care for chronic diseases, and so on.
Through programs such as Healthy Schools, the tech startup delivers checkups, treatments, and health education to children in partner schools. Additionally, field care programs take the clinic to the people working with factories, schools, or other community institutions.
We started really the model just with micro clinics, and these clinics provide basic primary outpatient services to people in the community, meeting people where they are, and instead of waiting for them to come to us, and being more proactive in taking that approach to finding people and bringing care to them. And really that's where a lot of our innovation in our model comes through is with field care. So we're able to experiment and try new ways of delivering care to people in the community. This is through backpacks, with backpacks that we carry around and bring different devices and medicines to people in the field. This is through the model itself, working and kind of task shifting with community health workers to help them help us to reach more people to the clinics and it kind of extending our reach within the community.
Education on health issues and concerns improves the community's access to healthcare services.
So really we see that innovation coming through there with the ability to try new things and reach new markets and reach new kinds of people and offer those services that are available in our clinic but might not be completely utilized or people don't know about.
Access Afya delivers this through community engagement to ensure patients have the information they need to make informed health decisions. Educating patients on their rights to care is a significant step towards a connected, informed, and healthy society. Access Afya is keen on the quality of care and products given to the patients who seek its services.
My name is Arpana Philip. I'm the Operations Director for Access Afya Health. A lot of what I do is managing supply chain and keeping an eye on the clinic operations, providing excellent service to our customers, making sure that customers know what great healthcare looks like, and they can sort of expect it when they go to other health facilities, even if they don't come to us, but really setting that standard in the community. And the second one is really giving them that service at a really affordable price. A big part of that is obviously getting medicines at the cheapest price possible, at the best quality. We use a very reliable supplier, and they have an internal lab. They do multiple tests on all the orders that they receive, and they do a lot of controls on our behalf. And they are trusted and tried across the country, and guarantee the quality of their products. When the products come in here, we do just an external assessment. If there's any returns, then we manage that, but we haven't had that issue so far. We've never really had an issue with our supplier, and so we stick to the one key supplier that we have.
Quality of care is also reflected in the staff at the clinics. Access Afya clinics have a licensed, trained and certified medical professionals who focus on building relationships with patients and the community in general. Access Afya is well grounded in respect to technology, and this is key to its business model. All health and operational data goes to the informatics department. This department analyzes and disseminates the information. The data is in turn used by other key departments like the supply chain to understand consumption, stock movement, and trends. The clinical data informs protocol adherence and disease prevalence in the community. The informatics arm of this organization is also crucial in the monitoring and evaluation of the projects. According to Osob Osman, working in schools has helped a great deal in predicting the kind of health problems children have, so that they can develop and tailor the right solutions, treatment, and education needed.
From the data, we can make decisions and understand our communities and how to better serve them. Working in schools in informal settlements for the past 2 years, we were able to become child health experts. Not only were we able to understand our impact, and we were also able to predict what kind of conditions children would have in those communities.
Access Afya's Innovation Lab integrates emerging innovations into their health services with the goal of improving health, social, and economic impact within the communities. These innovations could be applied through technology, partnerships, finance, new business models, and improvements on current product services and delivery.
We live and breathe our mission and our promise to our patients through having a sustainable model that is supported by a structure and departments that are aligned with that mission. Part of our mission and vision is to support patient care through our technology. Clinics are supported by an integrated system that connects our patients from one location to another. And with this infrastructure, we're able to scale and support multiple clinics with standardized care and quality protocols that are enforced throughout our network.
One example of innovation labs is Access Afya's chronic care management program, Akiba ya Roho.
So the projects that we're currently working on in this lab environment is, the first one is we have a chronic care program that we're working on called Akiba ya Roho. And this project is a chronic care program focused on diabetes and hypertension. And we are working with Boehringer Ingelheim and Ashoka to deliver this project. And it is, the first phase is to screen. That's about awareness and education and getting people to really understand what is diabetes, what is hypertension, what does it mean to have a high pressure, high sugar, and what does that impact have on your health. And so to do that, we're screening 10,000 people within the communities where our clinics are. And through this screening, we're using community health workers to help us to screen, to do the screening, to do the education and the mobilization in the communities. And we're learning a lot already. We're about halfway through the screening process. And so after the screening, they come to the clinics and they get a series of testing done blood, urinalysis, ECG, testing their heart, eye check, all of those things. And then we're going to follow them for 1 year and see if working with them on a regular basis every month, 2 months, getting their medication will have an impact after a year in terms of managing their condition and being under control.
Access Afya stands out because it cares about its patients and takes the extra step to follow up with them.
Our patients receive a phone call after their visit or a message to check on them on how they're doing. And our goal is to ensure that we confirm that our patients have recovered. Outcome is very important to Access Afya. To date, we're proud to say that Access Afya operates and runs 3 successful clinics, 2 in the Mukuru area, in Kayaba and Lunga, and the 3rd and our most newest clinic in an area called Kiambio in the Isili area. We are very excited to be part of those communities because we know we are change makers, and we have a team that is dedicated to ensuring that the community is educated and that they receive the best quality regardless of where they come from.
This outcome-driven approach helps patients achieve their health goals, while Access Afya learns from its data to improve the product and service delivery so patients can continually access the care they want, need, and afford.
So at Access Afya, we have a huge focus on the quality of the services that are delivered, and how we look at this is being able to achieve the outcomes that people care about, which is that you got better, and that clinical practice guidelines were adhered to, the sustainability and the ability to continue to provide these services in a way that is affordable for the organization, but also affordable in a way that the people purchasing these services are able to gain access to them without too much financial difficulties, as it would if they were to access private healthcare in your standard available facilities. And through this model, then we're able to replicate these units in different communities and therefore multiply the impact across the informal settlements within Nairobi.
Access Afya's model has significant impact not just for the health of patients. It is a cost-effective model for universal healthcare delivery that can be replicated and scaled globally. In Africa, technology is becoming an increasingly significant tool for improving healthcare. This explains why there are many startups in the health technology space with an aim of transforming the healthcare sector. For Access Afya, continuous development of its model is among the firm's top priority. Currently operating within 3 communities in Nairobi, the firm is planning to expand and grow more in 2018.
At Access Afya, we are on a mission to deliver the best quality care to the mass markets. We currently have 3 clinics with plans to open 2 pharmacies by the end of this year. Next year, we are excited to say that we do plan to open 10 more units within the Access Afya family.